Today, we're going to talk about how to stay motivated for the long haul. Whether you have a rehab goal or a fitness goal, the journey is long and sometimes the progress is extremely slow, which can make staying motivated a little bit more challenging. And that is why we are going to go through this today in order to give you the tools necessary to help you to do the things that you need to do every single day to achieve those bigger goals. So in this video, we're going to talk about what motivation is, some reasons why your motivation might kind of go through some peaks and valleys, and of course, some tips or solutions on how to do the things that you need to do every single day in order to achieve those big goals. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel, we talk about anything and everything related to mobility, health, fitness, and mindset with the end goal of empowering you with as many tools as possible to live an overall more active, happier, healthier, more fulfilled life. And with all that said, today we're going to tackle this topic of motivation. It is a critically important factor when it comes to doing the things that you need to do every single day. And it does come up quite a bit with the patients that I see in person and also with the live sessions that we do every month with people just asking, how do I stay on track with my fitness goals and my rehab goals? So first, let's just clear the air on what motivation is. Motivation is really just the desire to change. The reason I want to start with that is I want it to be crystal clear that our motivation probably stays the same throughout, but because our day-to-day behaviors and feelings may change, we think that our motivation is changing day to day. So it's really important just to recognize that motivation is the desire to change, and your desire to either improve your fitness or to reach that rehab goal is there. So you don't really have a motivation problem, even though I'm going to be using that word a lot today. It's not really a motivation problem. You are motivated. You wouldn't be watching this channel if you did not want to make a change for the better to make your life ultimately better. So motivation is probably what brought you to this channel to watch these videos, or what motivated you to come up with a treatment plan or an exercise plan or a daily schedule where you were going to do your therapy. The motivation was there to do that, but when you actually go to that time that you've scheduled to do your exercise or to do your therapy, you may not want to do it. So we're going to really be addressing that issue. So yes, I'm going to be saying motivation, but the motivation's there because you made the schedule, you put the plan in place, but maybe you don't want to do it when that time comes on that specific day. So why exactly does that happen? So yeah, I'm going to be terming that motivation. Why do you lose the motivation in that moment? Or why do you feel like you've lost your motivation in that scheduled time where you told yourself you were going to go for a walk, go for a run, go to the gym, or do your therapy? So there are a few physical reasons, like there's a few strategic reasons why you might not feel like you're motivated in that moment. And one is the physical barriers. So we're going to get to breaking these down a little bit more when we get to the kind of interventions or things that you can do to make sure you do the things you need to do every day. But one is just physical barriers. Either you can't do the exercises on your own, or you can't get yourself into that room in your house where you're going to do these exercises, or you can't drive yourself to the gym. Those are physical barriers that are interfering with your ability to stay motivated. So that right there will immediately kind of drop that motivation or that desires because you can't overcome that hurdle. The other one is stress. So actual just physical stress of feeling like you have too many things going on in your life, and that might make your motivation wane a little bit. Is doing that therapy or doing that exercise just feels like it's going to add to that stress level. So that's another kind of barrier to carrying out an exercise plan or a rehab plan. And then the other one is that I hear a ton is you don't have access to therapy. So I get a lot of people that say that they can't do the things that they need to do because they don't have access to traditional therapy. So those are all valid reasons why you might feel like you're not motivated. But then on top of that, there's also kind of mental reasons that we might lose the motivation. And one is fear, whether that's fear of failure, whether that's what I call fear of fear. Maybe you don't like the feeling of being afraid of the unknown, and so you just don't even approach this area. Maybe you put the plan in place, but like when that time comes, you just don't want to go there because you don't want to be afraid. Maybe it's a fear of falling. Maybe it's a fear of not being able to do the things that you want to be able to do, or you might not meet your own expectations. So those are all valid fears that you might have. The other one, if you have MS, is a fear of an exacerbation. Or maybe you have a fear of overheating, or maybe you have a fear of feeling more fatigued after the fact, and you've been fatigued before and you don't like that feeling. All extremely valid, especially when it comes to that fear of fatigue, fear of overheating, and fear of an exacerbation. And for those fears, I would say that there's tons of evidence that actually suggests that a regular exercise program actually helps with fatigue with MS. If you have MS, and it does help prevent the frequency and maybe the intensity of an exacerbation. So sometimes when you have a fear, it's good to just kind of replace that with fact. And you can really just do a quick Google search on these topics, and you'll get a lot of data that talks about these things as they relate to MS. The other mental barrier that I hear is just confusion or overwhelm. Either it's confusion about your disease or what's going on with your body. And so you need to do these things, but when you go to try and do them, your body doesn't behave the way you want it to, and you just don't really understand why. Maybe you have spasticity and you don't really understand what this is or why your muscles do these involuntary contractions at like the most unideal times, or maybe it's pain and you don't really understand your pain or where it's coming from, but that overwhelm or that confusion around what you need to do is definitely a reason or a barrier that might prevent you from doing those things you need to do day to day. And I would say in that case, it goes back to just preparation, doing research, learning about your condition as much as you can, learning about spasticity if you've had a stroke, learning about the area of the brain that was damaged if you've had a stroke. All of those things will help to kind of decrease that overwhelm as you gain clarity. That could potentially help you to do what you need to do the hard things day to day that you maybe don't necessarily want to do. So gain more clarity. The other mental barrier is just pain. Your exercises, whether it's a fitness routine or whether it's rehab, some of it's going to be painful, especially if you're not used to exercising and you're just now starting an exercise program. There's going to be pain. If you're in rehab, things are going to hurt. And sometimes we can associate pain with suffering. And if we cross that barrier from pain to suffering, that is a mental barrier that is really hard to overcome. So if you are experiencing discomfort, maybe it's a good thing to do would either be to get into therapy if you can, or just learn more about what is kind of quote unquote good pain. So there is just muscle soreness that's going to come along with doing things that you haven't done before. And therapy can really help with that. So pain is okay in certain conditions, but it is good to have professionals involved to help you determine what is good pain and what's not good pain, so that you don't kind of bleed over into that suffering or start to perceive your therapy or your exercises as suffering. The other one is that it is just boring. And yes, I will say sometimes an exercise routine is boring. Sometimes therapy and those repetitions are boring. But in that case, I would say if you're doing an exercise routine and you're trying to improve your overall fitness, There are a million and one ways to skin a cat, and my suggestion would be to find a different activity. So if you're trying to improve your cardiovascular fitness and you absolutely hate getting on a stationary bike, or you absolutely hate getting on an elliptical, go for a walk. Try and find something that you enjoy. Play with your children or your grandchildren. Kick a ball around sitting in a chair. You could even kick a ball sitting in your wheelchair. Do something that is fun, but the reality is, if you're on the rehab side of things, especially brain injury rehab, there are going to be things that are probably necessary but aren't necessarily always fun. And in that case, I would say talk to your therapist, because there's probably a few different ways to accomplish the same end goal, that maybe you don't have to do that specific exercise, but maybe there's something in a different context that you could do that will still address that same movement problem. But the other thing I would say, and this is still more on the rehab side, if the exercises that your therapist is giving you are boring, well, don't do them. I would say anything is better than nothing. And yes, I am very guilty of giving people exercises because I think they're the best, or I think they need to do them because of whatever you've told me or what your values are. I think that you need to relearn this specific movement pattern. But again, anything is better than nothing. And if you absolutely hate what they're giving you and maybe you're done with therapy, just don't do them. Again, do something. So if it was trying to retrain your arm and you don't like any of the exercises that you were given in therapy, go online, Google it, Google arm exercises, and modify some traditional strengthening exercises to fit what you can do within your limits. So if you don't have grip strength, I've shown this a lot, you can just strap your hand to a bar, just get creative. And maybe that'll eliminate that boredom. But back to the beginning, long story short, there are still going to be times where you are bored, and I think you just have to accept that it's not always fun. And then the other one is just frustration. So maybe you lose the motivation because neuro rehab is long and the progress is slow, and the progress gets slower the further out that you are. So that can be extremely frustrating. And in that case, I would say that just accept it. The frustration is normal. And I would say just do what you can and maybe try and find a way to focus on the positive. Focus on the areas that are getting better, even if they're small. And then the other one is, and this comes up quite a bit, is that you just despise anything that has the word exercise or therapy in it. And this happens. I would say in the therapy world, especially brain injury therapy and stroke therapy, it's extremely common that you just get burnt out. You kind of get everything thrown at you at the beginning, and sometimes you just start to resent it and you just don't like it. Same thing with exercise. Maybe people forced you to exercise when you were younger, and now you just despise it. And for that, I would say maybe there's a way you can reframe it or just start fresh. And maybe now that it's in your control and it's something that you're in charge of, you won't necessarily despise it. So maybe you just take control of it now and you design the program that you believe that you can do and is best for you. And that might be a way to reframe that and kind of not have that like resentment attached to either therapy or physical exercise. Now, for a minute, I just want to talk about goal setting. So when it comes to motivation, you need goals. You need to be working toward something. And in that case, I would say the best goals are the goals that are flexible and they kind of change with your lifestyle. So if you've had the same goal for a really long time, and maybe your goal is just, I want to walk. Well, maybe make that goal a little bit more specific. Maybe you need to make that goal, I want to walk to the store, or I want to be able to walk into an airplane, or I want to be able to walk onto a boat. Maybe you need to take that goal and just morph it a little bit if you're someone that's kind of in a dip. You've had motivation and now you're kind of in a little bit of a dip. I would say look at that goal and just change it in some way. The other thing I would say, and this is just from my experience and the patients that I've had, that I've talked about this before, that I consider kind of the outliers, the ones that are still making progress 10 years, 15 years after the fact, is try and look for goals. So it's really easy, and I hear this a lot, is that I used to do this thing, I used to travel a lot, but then I had my stroke and now I can't. Or I used to watch my grandchildren and then I had my stroke and now I can't. That's one way of looking at things. But then again, I have these outliers that I kind of always look at and observe kind of with curiosity and just kind of to learn from. And I would say the other way that I see people that fall into this category that are continuing to make progress even 10 years later is that they never don't have goals. So they rarely say things like, oh, I can't do that, or I'll never be able to do that. I find that they're always looking for a goal. Okay, they'll tell me, well, now I want to be able to do this. Or last year we went on vacation and it went okay domestically, but now I want to go on an international vacation. So I need to learn how to take an international flight, walk onto a bigger plane, or I'm going to go on a boat tour, so I need to be able to get on and off of a boat. Or they're just constantly looking for something to work towards. So I'd say instead of having some of those limiting thoughts, maybe try, and when you recognize that you're having some of these limiting thoughts, like I could never do that, or I don't want to do that, or, I used to be good at that and now I'm not, so I don't want to try that. Maybe you can replace those with more ideas or like a problem-solving mindset of how do I overcome my physical limitations to be able to do that thing. So that's enough about goals, because I have done an entire video on how to set goals, and I will put a link for that video in the description below. But now let's just talk about the strategic day-to-day ways to maintain your motivation. And number one, and I've talked about this before, but there's a lot of you that are new to this channel, is setting up your environment to make it easy, whatever that may be. The fewer barriers involved in actually getting started in that daily practice. And I do mean daily. It may change. You may not do the same intensity every day, but I do think having an exercise routine that is daily is extremely valuable. So if you're not there, just something to think about is that it is valuable. Maybe it's not going to the gym, but maybe it's going for a walk, or maybe it's propelling your wheelchair, around the block, or whatever it is. I do think that daily, it should be a good goal that everyone should work on, but making it easy. So for example, if you sit in the same chair every day, maybe you set some TheraBand by that chair and you do your arm exercises when you're sitting in that chair before you watch television. Or if you're someone that has a lot of energy in the morning, maybe you set that stuff up right in your bedroom, and before you leave your bedroom to start your day, you do it right there in your bedroom. For others, maybe it's just getting your clothes out the night before that you like to exercise in, that make you feel good, and having those ready. Sometimes even just looking at them first thing in the morning, that drives your motivation a little bit. So that's another strategy that might help to make it easy. And then the other way to kind of keep your motivation is just to experiment with different things. I try and give a ton of variety on this channel because of the fact that I think you do need to be changing up your routine. Yes, for the brain injury recovery and the rewiring, there are certain things that I talk about that you need those repetitions. But in addition to that, there should be a component of your routine every single day that is flexible, where you can experiment with different things. Maybe you used to play golf and you just keep a golf club in your kind of exercise area and you just do a few swings with the golf club. Feel what the weight shifting under your feet feels like, and just kind of explore that. Just do something where you have the ability to problem solve and be curious and to think about it and figure out how you make it better, how you make it feel more smooth if you are working on that golf swing. Just something to, again, kind of get that creative area of your brain or that problem solving area of your brain engaged. And sometimes that too can help with motivation. And then the other thing kind of along those same lines is find something you enjoy. I can't stress it enough. It's probably the third time I've said it, but you do need to have fun. You need to do something you enjoy. And I think as we get older, we feel like everything needs to be work and that it shouldn't be fun. And that is 1000% inaccurate. Even though we all kind of adopt that as we get older, you need to find something you enjoy doing. Whether it's an exercise routine or even therapy routine, it doesn't have to be perfect. You don't have to do that thing perfectly, but if you enjoy doing it, then try and find something in that area that you could incorporate into your exercise routine or your therapy routine. And then the other thing is just get good at something. So mastery has been shown to kind of boost our motivation. So when we're working towards kind of becoming an expert or achieving mastery at something, that can improve our motivation. And so you might have to reframe this a little bit. If you've had a stroke or you've had a brain injury, maybe it's, I want to get good at or master how to do all the equipment in the gym with hemiparesis. And how do I need to do that? What can I do with my hand to get it to use traditional gym equipment? Or maybe you want to get really good at getting on and off the floor. That actually is a pretty cool trick. I had a patient once that was like 85, and the first thing he wanted to show me was how limber he was and that he could get on and off the floor. But he was 85 years old and he was extremely fit for his age. And so that kind of proves my point that just he felt like like he had gained mastery in that area and he was really good at it. And so that just gave him a little bit of pride. But get good at something. There is something. Even if you have hemiplegia, even if you have paraplegia. You know, I've seen some paraplegics do some amazing things. They've probably paraplegia is paralyzed from the waist down, but some of them have taught me more than I could have ever taught them about how to do things from a wheelchair level, how to go upstairs with your wheelchair, and they were very proud to show me these things. So gain mastery or get good at something, and there is no physical limitation except for the limitations that you place on yourself. So keep that in mind, and that will be one way to maintain your motivation to do sometimes the things that you don't necessarily want to do, but that you know you need to do. The other one is just be flexible. So I've kind of hit on this already, but just don't necessarily be rigid in your structure, your day-to-day structure of how you do it or what you do. Have a few different things in place. I do recommend, though, that you do it at the same time and that you kind of make that like a non-negotiable, because if not, sometimes it gets pushed out of the way, but that's kind of up for debate. But I would say that just be flexible. If you're sore in one area of your body, you should plan for that. Okay, like if my legs are sore, I can switch to my arm workout for today or whatever, but have a little bit of flexibility built into that as well, so that you don't just bypass that day altogether, which is worse by far. The other way to stay motivated is to get help. So whether that's with a personal trainer, for those of you who have the finances and you can afford to do that, I highly recommend that. I don't think you need to be in skilled physical therapy indefinitely. I do think that, there is a point, whether you have MS or you're recovering from a stroke, where you need to continue, but it doesn't necessarily need to be with a skilled physical therapist, and that's where personal trainers come in beautifully. Not only that, personal trainers come in beautifully from the beginning. In most cases, you're not going to see physical therapy every day. And the patients that I've had that have been able to do personal training with physical therapy by far have the best outcomes. So get help if you can. If you don't have the finances, think outside the box. Maybe you just need to hire someone to walk with you to go for those walks because you don't feel safe. Well, then you don't really need to hire an expert. Maybe you could hire your grandchild or someone that can just walk with you that can help you to when they show up, that kind of is going to motivate you a little bit to work with them because they showed up. But B, eliminate maybe any fear of falling or anything like that. That might be a barrier that might prevent you from taking action or just moving. And then finally, I just want to say that motivation isn't always necessary. So I would say even this whole video is on motivation. Not being motivated is okay. You could not be motivated for a week or a month. And in my opinion, I don't think you should dwell on the fact that you're not motivated. I think you should just accept it and come to terms with the fact that you might have to do things that you don't want to do. And the end goal is, in that case, you will develop some skills that will carry you through the next set of challenges. So doing things when you're not motivated is actually a skill that is going to come in extremely handy down the road as you continue to push those goals. So long story short, you can implement all of these things, but I still think there are going to be times when you just have to do something. Anything. And then the other thing I want to say is if you are not motivated to move, like obviously the whole point of this video is geared towards motivation for exercise and therapy. The final point I will say is learn something, learn anything related to exercise or your brain injury, learn something about MS, learn something in the area that revolves around the problem, the movement or physical problem that you're trying to solve. Knowledge is extremely powerful, and sometimes that is the catalyst that will get you back into a motivated state. So, for example, let's say you do have a fitness goal and you want to get better at fitness. Look up exercise and heart rate. That's something related, and you can, trust me, because it happens to me all the time, you can go down the rabbit hole of all the different things that the heart does and how the heart is involved with exercise, or maybe just Google search fun exercises or how to stay motivated with exercising. Google something. There you will learn something that will help you to overcome that barrier and start moving again. And then the final point I want to say is plateaus are normal. Falling off the wagon, so to speak, is normal. We can't stay high all the time. We can't stay enthusiastic all the time. And so not to feel ashamed or beat yourself up for it. Maybe you haven't done your therapy in a year. Maybe you haven't done your therapy in 2 years. Maybe you haven't exercised in 5 years. Maybe not exercising is what led to your stroke. Whatever the case may be, we all have lives. We all have reasons why our motivation wanes, and sometimes we stop doing certain things that we know are good for us altogether, and there is no shame in that, right? So you just have to kind of get back on the wagon, doing whatever you can. Maybe you start with the learning phase and you don't even put your plan together yet, but do something that gets you moving in the right direction. So I hope you guys found this video helpful. If you did, definitely give it a thumbs up. If you have any questions or comments or personal stories about how you stay motivated, definitely leave those in the comments below. If you want some exercises to keep you motivated, head on over to Instagram and follow us over there, where I post 1 to 2 exercises every single week to kind of keep your routine flexible and allow you to experiment with different movements. If you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll get notified every time I upload new videos. Don't forget that another way you can learn is to join us on our monthly lives. That is one of the main reasons I've put these lives together, is it's an opportunity for you to get your specific questions answered. And sometimes that what you learn can decrease that overwhelm you might be feeling, might decrease that fear you might be feeling, and it might be just what you need. Getting an answer to your question might be what you need to overcome that motivation barrier and get you back on track. So again, we do monthly lives every single month. This month, it's actually going to be next week. So if you want to sign up for that, link to sign up for that live Q&A is in the description below. We would love to see you there. I enjoyed spending time with you all today, and I'll see you in the next video. Have a good day.